Hello everyone. Today my topic is clinical examination of the breast. So in this topic I'm going to discuss about the what is the introduction of the breast, about the anatomy and its arterial supply and venous supply, and also its lymph nodes, what are the lymph nodes supplying to breast. So what are the complications, how we are going to assess the breast, what is the importance of the breast examination, and also what is the benign and also malignant cancerous. So we are going to find the different types of the signs and symptoms in the breast cancers. So we are going to discuss all these things in today's topic. So coming to the breast anatomy, so breast is a mammary gland. It is a adipose tissue. So if you see the breast size and shape, so it is considerable in the individual variation. So it depends upon the person to person. It will be vary the size and shape. It will be vary. So the location and also the shape and size. So it's exactly at the vertical from the second to sixth rib of the mid-clavicular line, and horizontally from the midline to the sternum, almost mid-axillary line. So from here, so I'm from the second rib to the until the sixth rib, and also this is the vertically, horizontally from the midline to the sternum, almost to the mid-axillary line. From sternum to the mid-axillary line here. So this is, and also superior laterally extend from the axillary tail of Spence through the foramen of Langer. So it's going to be up to the axillary tail. So this everything is the location of the breast and also its extension of the breast. If you see here, you can clearly understand. So this is the location of the breast from the second rib to the sixth rib, and also it's a vertically in the horizontally. It's exactly from the midline to the mid axillary line. So that is the location of the anatomical structure of the breast. So if you see this breast, if you take out the layers, so exactly in the pectoral region. So if you see the major parts of the breast, so here the major parts of the breast, here you can see the nipple and also areola. So these are the major role and also in the breastfeeding. So coming to the areola is a pigmented and circular area of the skin around the base of the nipple. It contains a large number of subcutaneous glands which enlarge during the pregnancy are called the tubercles of Montevideo. And also the nipple. Nipple is going to be cylindrical or conical structure and also projecting from the center of the areola. It contains subcutaneous network of the smooth muscle cells and also elastic fibers. So if you see the nipple is going to be elastic fibers is going to be so it gives its surrounding to the areola. So coming to the breast glands. So if you open and also if you go internal structure of the breast, each breast has 8 to 10 sections of the lobes. So if you see here, you can see the lobes here, and also inside each lobe are many smaller structures called as lobules. So these are the lobules. So more than 10 to 8 lobes are there, and also it having the lobules. At the end of the each lobule is a tiny sac, that is the bulbs. So these are the internal structure of the breast. So coming to the arterial supply. So arterial supply, the major blood circulation, so is supplied by the lateral thoracic branch of the second part of the axillary artery. The main artery supplies is the axillary artery. So that is the internal thoracic artery branch, and also the medial mammary branches of the internal thoracic artery. So internal thoracic artery and also is going to give is a major branch from the axillary artery, and superior thoracic branch of the axillary artery, lateral branch of the second and third, fourth, and also posterior intercostal arteries. So these all arteries are going to supply to the breast tissue. So coming to the venous drainage. So venous drainage so is supplied by the circular venous plexus deep to the areola of the base of the nipple, and from the plexus of the two sets of the veins formed from the superficial set and in the internal thoracic vein. So this is the internal thoracic vein, and deep set ends in the internal thoracic, axillary, and also post intercostal vein. So lateral thoracic and also post intercostal vein. So these all veins applies to the breast. So these veins supplies that takes the deoxygenated blood from the breast tissue to the internal thoracic vein. From here, this going to connects us to the is going to the internal, like a superior vena cava to the upwards to the heart. And also the major lymphatic drainage. So the five groups of lymphatic vessels are there, lymph nodes. So these are the anterior set, posterior set, and lateral, and also lateral set, central set, and apical set. So if you see here, you can clearly understand what are the central sets, the lateral sets. Why we have to know these are axillary lymph nodes or axillary nodes? Why? Because of if after the surgical procedure, after any breast cancer surgical procedure, after mastectomy, so these lymph glands or lymph nodes may chance to get the enlargement, or maybe sometimes it may obstruction, and also it may swollen because of the abnormality of circulation. So that's the reasons. So we have to know while checking the breast examinations, we have to understand what are the lymph nodes are there. So we have to know the all the sets of the lymph nodes. So if you see here, the lymph nodes, the anterior set, these anterior sets are situated along the lateral thoracic vein under the anterior axillary fold that lies mainly the third rib. So if you see here, these are the anterior axillary nodes. So these are exactly at the third rib. So if you see the first and second, the breast starts from the second rib to the sixth rib, but these axillary nodes are going to be originating. It starts in the third rib. So coming to the posterior set. So this posterior set lies posterior axillary fold in relation to the subscapular vessels. So these are the subscapular vein here. So it's going to be the is a posterior to the vein is a posterior axillary sets, axillary nodes. The lateral is going to be along with upper part of the humerus in relation to the axillary vein. So these are the lateral axillary nodes. And also, next one is the central one. Central axillary nodes located in the center and situated in the upper axilla. And also apical and also infraclavicular. Infraclavicular means is the inferior to the clavicle. So inferior to the clavicle. So these are the infraclavicular nodes. So these are the lymph nodes. So these lymph nodes may chance to get the enlargement, or sometimes may chance to get the obstruction because after the mastectomy, after removal of the breast in the breast cancer. So how to examine this breast clinically? What is the importance? Mainly, the importance is to identify any nodules. That means, is it a malignant tumors or benign tumors or any cyst or maybe any sebaceous cyst. So we have to find out which one is the normal one and which one is the abnormal one. Sometimes women may chance to get the some cyst or maybe nodule formation because of the hormonal imbalance, but it may sometimes it may progress to breast cancer. So that's the reasons we have to identify the which one is the normal tissue and also which one is the abnormal tissue. That's the reasons we have to assess clearly. So here we have to check the take history from the person. If any person complain about the like a breast pain or maybe any discharge of the fluid or any size change or shape change, any fluid discharge. So anything we have to take the proper history. So here we have to take the personal history from the person. The personal history we have to take the age and also about the sex, that is a male or a gender. So this breast cancer, why we have to mention here breast cancer not only in the female, male also may chance to get the breast cancer. So we have to check for the both male and female. So that's the reasons we have to is it a male or female, and also we have to check for the any present history, any lump, or is there any discharge or any pain, and also we have to check in the present history. So coming to if anybody found the lump or if they find any lump during their examination or assessment, so what we have to discuss here. So here, if anybody have found the lump, so this lump is the when and also how did they first notice. So this is going to be when they first noticed and also how did they notice, or during the taking shower or bath time, or maybe because of the pain or because of any like the self-examination. So we have to ask them so when and also how they noticed. So for this one and also where is the side, so which breast is it, right side or left side, and also where in the breast is a axilla. So that means near to the nipple or areola or axillary tail, or where exactly, or maybe is superior to the breast or maybe the rib, second rib or third. So where exactly we have to know, is it a lower breast or upper breast or maybe the axilla, we have to confirm it and we have to ask. And also size. So size is how much size. The size is changing, increasing the change, increasing the size or not. So does this change with the is a menstrual cycle? Sometimes during the menstruation, the lumps may chance to get, and also after menstruation, it may disappear. So that's the reasons we have to check: is there any relation with the menstruation or not? And also shape. So what is the breast shape or maybe lump shape? So is there any lump shape? Is going to be is a regular or irregular? We have to ask. And also texture. Is it hard or soft? Are smoothie are also bumpy. So is it a hard tissue or is it a smooth or bumpy? And also is there any changes in the temperature? So is it cool or hard? And also we have to ask the difference. And also color, what type of the lump? Is it we can palpate, and also what type of color? Is it the bright or red color or orange color? Sometimes a pinkish color. So we have to ask the color. Does it move is around? So if you press the breast lump, or is it moving forward and backward or side to side, or is there any movement is there or not? So we have to are any fixed one. What are the breast like a normally like? So is it looks like a normal or abnormal? So if you find all these things, so then we can check. So how and when it first notice. So this one is find out the patient ICs and also clues to the disease etiology and also breastfeeding. So we have to ask about the patient's ideas and also concerns and about the expectations and also clues and about the etiology of the disease of the etiology. Or we have to check: is there any is the patient having any fear or any stress or any anxiety or maybe any breastfeeding? So we have to know the history of the from the patient. And also the site. So some cancers are more commonly in the certain parts of the breast. The location of the lump may also be relevant for the management decisions. So it depends upon sometimes they may chance to get the nipple region, or sometimes it's going to the axillary or maybe superior. So if you know the site exactly, so doctors they're going to identify, and also the plan of the treatment will be different according to the location and also site. And also size. So size, so slowly growing lump suggests the carcinoma. So if it is slow growing means, so if the size is increasing very slow means it indicates the carcinoma. Rapidly expanding lump, which is now hard, suggests a cyst, and also suggests changes occurring with the menstruation, suggests the fibrocystic changes. So that means if any changes, the size is changing very fast. So if it is maybe because of the menstrual irregularity or abnormal of the hormone secretions, or maybe is the changes occurring the that means the fibrocystic changes, or if the lump expanding is a very hard, so it may be cyst. And also shape is shape. We have to check if the shape is going to be irregular. Is suggestive of the carcinoma. If it is irregular, so it's there is no proper shape, so we can indicates the carcinoma. But in case of if the round and also if it is lump-like structure, it is also called as the fibroadenoma. So fibroadenoma is a benign type of like a it's not a cancerous, it's like a lump, so it won't give much complications like a metastatic cancers. And also textures. So if you see this one, carcinomas usually hard lumps with an uneven surface. So it's going to be hard surfaces. We are going to find the hard, and also it's not an even surface. Our cyst may be initially be the soft, but once full, the fluid, and also it feel hard and also smooth. So that is difference between the carcinoma, the tumor, and also cyst. And also the temperature, the heart and also erythematous skin indicates the infections. So always we have to ask them the temperature. Is it are they feeling the heart? And also is maybe erythematous. Erythematous means the appearance of the color, the red color appearance, or pink. In case of like a infection, the card main signs are the pain, tenderness, and also warmth, and also the is going to be the redness. So these are the major features of the any infections and it's inflammation. So we can differentiate to the carcinoma and also to the infections. And also does it move? So the mobile lump more likely to be a benign cyst. So if it is moving, if you are if the pressing, the cyst is moving side to side, so it indicates the benign cyst, are also called as fibroadenoma. And also its a fixation suggests is going to be cancer. So if it is fixed, so if the lump is not moving, if it is particular one place, so it suggests to of the cancer. So we need to know how they have in the change from the normal or lumpy breast or the suggest the fibrocystic changes. So that means is a lumpy, it looks like, so it indicates the fibrocystic changes. So that means there is a benign and also it's going to the like a hard structure. So that is, if anybody found the lump, so we have to differentiate. Also, we have to take the history from the patients. We have to take all the history, like all the information from the person. So then easily to diagnose and also manage the in the early condition. That means to manage the problem in the early days. We can prevent the other complex severe complications. So what is the difference between the if the person get the pain? So in the pain, so we have to differentiate the is there any painful or the painless. So how to differentiate? So what will be the could be the reason. So in case of painless lump, so in the painless, so it may be the cyst or maybe carcinoma or fibroadenous and as fibroedema and fat necrosis. This is painless. But in case of painful lump, so is going to be the cyst, or maybe is the abscess. Abscess means pus formation. If any lump and also is a pus formations, and also fibroadenosis, periductal mastitis, that is the inflammation of the mastitis, breast, or maybe is a carcinoma in very rare case. So most of the, if you see here, if the painless breast cancer or painless lump, it indicates the cancer. So if it is pain, so maybe may chance to get the abscess formation or any infection, or rarely it may be the cancer. So that is the if there anybody get the pain. And also next about the discharge from the nipple. So if any discharge from the nipple, so we have to check the what type of discharge. So is it serous discharge? So serous discharge means like a fluid discharge, like a watery or secretions. So in case of early pregnancy and also fibroadenosis, they will get the serous discharge. And also milky discharge, like a milky, like a white appearance. So it is a late pregnancy, lactation, and also puberty, prolactoma. So this maybe is because of the milky discharge. Are yellow, brown, and green. So it may be the fibroadenosis. So this is depends upon the why we have to check. So we can easily diagnose if it related to the pregnancy or maybe the milky. We can easily identify or maybe the pregnancy or maybe lactation time, or if anybody having a yellow, brown, green. So these are the indications. So we can easily diagnose is it fibroedema or carcinoma or maybe the fibroadenosis. So we can easily diagnose. So that is the major diagnostic clues. So next one is the thick and also creamy appearance. So this thick and creamy appearance maybe is the duct ectasia. So that means the duct ectasia means is nothing but is a benign breast conditions that occurs when a milk duct in the breast widen and also it walls thickens. So this causes duct become the black and also lead to the fluid buildup. It more common in the women who are getting close to the menopause. So if anybody get like a thick and also creamy appearance discharge, so it maybe we can find the duct ectasia. So it's most commonly we can find near in the like above 45 to 50 age group, that is near to the menopause group. Or in case of purulent, or purulent means any pus formation or any infectious. So that is maybe because of the retroareolar abscess. Abscess means pus formation. Or in case of breast abscess, in breast abscess formation, pus formation, or maybe in case of the TB and tuberculosis. And also in case of blood like a discharge, it may be is the intraductal carcinoma. So this blood is the main feature. So if anybody get the tumor or cancerous symptoms, so they will get the breast. From the breast, they are going to get the blood discharge. And also intraductal papilloma and also Paget's disease. So these are the causative factors for the blood discharge from the breast. So depends upon these clues, so we can easily identify the person having the serious issues or is any hormonal balance or maybe is the benign tumors. We can easily diagnose, and also if we confirm it, the treatment will be very easy, and also we can prevent the further complication easily. And also if anybody having any other complications such as the fever and retracted nipple or maybe trauma, so these are also causative factors, and also we have to consider along with any the previously what we discussed lump and also discharges along with any fever, so we can think about the other infections, or maybe we have to rule out the causative factor. And also we have to take the any proper history from the person, so we have to check with other assessment. So we have to ask, and also we have to check is there any swelling anywhere, any swellings in the lymph nodes in the axilla, or maybe inguinal nodes, or in the neck regions. So we can ask, is there any swelling anywhere? So maybe because of if the lymph node enlargement, or maybe lymphadenopathy, so or maybe other like a infectious disorders may chance to give the swellings in our body. So that's why we have to check any swellings. And also similar episodes maybe because of in the during the menstruation, is it appearing or again is going to disappear, again is coming, means so we can think about the any menstrual abnormalities. Or maybe any smoking, we have to take about the smoking. Smoking also may cause to factors for so many reasons, so many cancerous. So that's why we have to take the personal history. And also alcoholism, is there in diet habits, including the, any fast foods or high cholesterol food, also may chance to give the, this type of complications. And also breastfeeding and drug intake. So we have to take all the history from the person, then only we can easily diagnose the breast cancer. Is it breast cancer or is it really the lump? And also we have to take the cancer history. So history, we have to take the person history, age. So we, if the age is increasing, if it is 45 plus or if after menopause, so may chance to get the cancerous, or above the 50 to 60, so may chance to get the cancer. So that's why we have to confirm the age proper. And also family history. So we have to history about the family, any family history of the cancer or family history of the breast cancer, so we have to know. And also, are they exposed to any radiation? And also if they are working in any medical company or medical industries, so may chance to expose to the some radiations. Or if any high metal industries also may expose to the like a radiation, so we have to confirm it, are they exposed to any like a in the industry. And also we have to take the menstrual history, are they having any complications related to the menstruation, so such as if they got the menstruation early stage of the early age of menstruation. Some maybe in the, they may chance to get the puberty at the age of 10 or maybe 11 years, but some people may chance to get the menstruation at the after the 12 13 years. But it depends, may chance to get the early like a monarchy, and also early monarchy means early like a puberty or early menstruation, so may chance to get the breast cancer. And also other risk factors also, late menopause and late pregnancy also may chance to get the breast cancer. So that is the reasons we have to take the history, proper history from the person. And also we have to take other history about the metastasis. So if the any metastasis, any other symptoms like any recent back pain or any generalized malaise, that means a weakness, any weight loss, any nodules in the skin. Nodules means any like a round appearance, or any it's a nodule like a round appearance in the breast tissues. And also maybe in the jaundice, so related to the any abnormality in the bilirubin, in the liver dysfunction, or any mental changes, and dyspnea, and also pleuritic pain, any difficulty breathing, any chest pain. So these may chance to get along with the metastasis. That means that these are the associated symptoms with the breast metastasis. So that's the reasons we have to check the all the information from the person. And also common causes for the benign tumors. So benign breast masses are going to be because of the most common breast mass in the woman. And also fat necrosis, abscess formation. So any necrosis, any fat accumulations, and also if the niche tissue damage, and also abscess formation. Abscess means pus formation, any cyst formation, or maybe is a intraductal papilloma, or ductal or lobular hyperplasia, is a ductasia, lymphoma, granular metastasis. So these are the causative factors for the benign breast tumors. So if anybody having these causative factors, so it may won't be effect to the other breast tissue. So it may be effective only for the particular breast tissue. Maybe it increasing the size of the nodule, and also cyst, that is a benign mass tissue. So what are the where exactly they may chance to get the breast cancers? So if you see here, so here is going to be you can divide the areas here. So nipple and area structures is going to get the 25 percentage. So highest percent is going to the axillary tail area. So this area is going to be more prone to the breast cancer. So only 5% is going to be the inferior side, and also here. So we have to know where exactly. So that's the reasons we have to found the where exactly having the breast lump. So easy to identify the breast cancer also. So we have to assess properly, and also before assessment, so we have to communicate properly with the person, and also we have to give all the like guidelines about the assessment plan. So here we have to ask them to, we have to advise, and also we have to inform what we are going to do and how we are going to do, because of this is the like a personal and also these private parts. So we have to explain clearly after their approval only. So we have to examine properly. While examining, so any like attenders or maybe their like caregivers should be beside with the patient. So here we have to ask them to after advice, after explanation about that our assessment procedure. So we have to ask them to remove the upper body clothing, and also ask them to expose the body exactly in the breast area, and also inspect the opposite side, so can compare for the asymmetry. So here we have to check for the right side and also left side. We have to ask them to expose the both the breast, and also we have to compare the right side and also left side. So then we have to find the any asymmetry. Any asymmetry means, so what is the size of the right side breast, what is the size of the left side breast, is it the same size, or is the right side is breast little bit smaller than the left side, or maybe either vice versa. So we have to check which one is the small or which one is the bigger. So and also then we can go to the any tenderness. So if ask the patient if tenderness before start touching them. So and also warm your hands. So there, so we have to place the before touching them. So ask them to do any tenderness. So if they palpate, is they having any pain, and also if the touch is there any pain is increasing with our palpation. So is there any tenderness is positive or negative? So we have to palpate and we have to check it. So why we have to do this one? So that means in case of infection or in case of inflammation, so they may chance to get the pain and tenderness. That is the most common symptom. So compared to the carcinoma, carcinoma won't give much like a tenderness. So we can diagnose, and also we can predict easily if any tenderness is there or not. And also, before start this one, so just now we discuss introduce yourself, and also ask permission to perform the examinations, and also assure the privacy. We have to give the privacy, and also ask for the chaperone to be present. So that means any attenders are their family members or caregivers, and explain what you want to do. So we have to explain clearly, then expose the patient adequately. So we have to explain adequately. That means what we are going to do, how we are going to perform, what purpose we are going to do this assessment, and also position of the patient correctly. So we have to check the position. That means we have to proper position. The patient should be relaxed, either sitting position or in the lying position. So, but we have to give the proper comfortable position to the patient. And also if any visible source, for example if any like a tumor, if any like a wound or any source, so we have to wear the gloves, then only we can apply our assessment plan techniques. So here what are the methods of inspection? So first one is the inspection. So in these inspections, so we have to do ask them to do in the sitting positions. So arm should be aside. So and also these positions we have to check the breast size and shape, and also we have to see the nipple, the play, and also nipple. So that means if the nipple is inverted or maybe retracted, or maybe nipple small or big. So we have to check that in the sitting positions, arm should be aside. So that means if you see here, so what we can find the, is it an asymmetry, or is the right side is the smaller size or left side is a bigger size. So we have to compare which side. Or and also then we can ask them to change the position from the sitting positions, arms aside to the, and next one is arm overhead positions. So in the arm overhead positions, so because of the elevation of the limbs, so the breast tissue is going to move upwards. So we have to find any difference in the arm hanging positions, in the resting position, and also overhead position. So these positions we have to check again the any symmetry or asymmetry of the breast tissues, as well as we have to found any like a changes of the shape of the breast. So in case of overhead like a arms overhead positions, because of the lump side may won't come upside, maybe it comes downwards. So we can feel, we can find easily the if any lump or any like a extra tissues we can easily found in this position. And also another position is arms pressing on the hips positions. So we can ask them to do in these positions. From these positions, then ask them to lean forward and bending forward. So in these positions also, how the tissue is going to be moves forward, or maybe how it is going to be. Is it one breast is going to be move forward, or that depends upon the lump side. So if any swelling breast, it won't like a sag, or it won't move forward. So we have to check the any asymmetry. So there also in this next stage is so bend forward stage. So the next one is the position. Position here we have to check for the sitting positions, check for the asymmetry, any mass, and also skin and also ulcer. So we have to found it in the sitting positions. So look for the any symptoms. So we have to check for the any lump. So here any like any extra tissue or any round appearance, or maybe is the nipple, nipple is in the pulled or outwards or inwards. We have to check, and also dimpling, any dripping, any red and rash, and also any skin changes. So we have to find the all the symptoms. So look, if anybody having any lump, so then we can find it. Okay, where exactly have the lump? If the limp is a nipple is retracted or open, or is a inverted. Inverted means is going inside. I'm going to see in the next page. So he's going to dimpling. So he's pulling inside. The skin is going to be like a wrinkles formation, and also dripping, any discharge, any redness or rash, or maybe any skin changes. So first we have to identify any other any problems from here. So then we can look for the other symptoms. So any conditions like in the skin retractions. So retraction means the skin is going to be like a wrinkles and also foldings, and also dimpling is because of any like a healing after the any injury, how the scar formation is going to be happening. So same thing it may chance to get like a, that is called as the dimpling. So we have to find the any retraction or also dimpling, and also we have to check for the any redness. So any redness or any color is going to be orange, or any vein congestion, or is it maybe inflammations. So inflammation conditions is going to get the like a redness and swelling, and also inflammation of the, see here, this is going to be the inflammation of the breast. So you can see the swelling and also redness, tenderness, and also they may chance to get the severe pain also these conditions. So nipples also. So here we have to check for the nipple. So here also number of nipple we have to identify. How many numbers? Number normally is a one only, but because of the is a inversions, so is going to be is going to get the, they may chance to get the two nipples. So the split is going to get the split into the two. So we have to found it. So it's going to be the, so in this one fibrosis or cancer are normal. So we have to easily identify with these assessment plan. So we have to find, is it the nipple is the normal, or any discharge, or maybe inverted or retracted, or maybe any like a split, any splitting of the nipple. So these things we have to identify at the nipple. And also next one is the any bleeding. So or maybe any like a paget disease. This paget disease means, so it's a very rare entity, but it's a represents 5% of the all breast cancer cases, associated with an underlying malignancy in 90% of the cases. So here what happened, the characterized by the crusting is a eczematous appearance of the nipple in the areola. So if you see here, you can see here, so this is the eczema, how the can like a, the skin disease is going to like a scaly appearance. So the areola is going to becomes like a eczematous appearance. So in this is condition, if anybody having, so we can easily suspect, so that is nothing but is the Paget disease. So this is going to be is the very rare percentage, but in the 5% is going to be happening in the all the breast can 90% of breast cancers. So coming to the, ask the patient to raise the arms and place the hand behind the head. So if they in overhead positions, so here we can check for the any masses related to the positions. Any nipple or skin is a tethering. So is going to be, you can check here. So in conditions we are going to find, or any maybe going to change the, any nipple is going to, nipple or skin going to be threatening, or maybe any change of the mass. If we raise the hands, the mass change is going to be moves forward or back, side to side, or where exactly changing the mass. So this one we have to ask them in the overhead positions. And also next about the uh, inspect for the whole skin. So here we have to ask them to like, I mean the raise the breast up, or maybe we have to hold the breast and also lift it up. We have to check for the any other factors, or maybe any redness or any swelling, any tenderness, any changes in the skin color. So we have to find, and also we have to examine properly under the breast area. And also coming to the axillary lymph nodes. So here, and also we have to find the any lymph node like a assess. Here we have to check for the lymph nodes like examinations. So we have to find out the axillary tail and also axillary lymph nodes, any masses or any ulcer, any wound or edema, and also is there a nodule, is it movable or non-movable or fixed one? We have to find it, and also we can see the any cancerous. So these are going to be, we have to check and we have to palpate clearly. So we have to palpate the all the areas, the anterior and also posterior, laterally and centrally and infraclavicularly. So all the places we have to palpate with our hand. So then we can easily identify the any nodule or any like a mobile tissue. So when we can easily identify. So how to do this one? So here is next position is the patient pushes the hand. So here we have to check for the dimpling or any fixations. And also the large breast patient lean forwards, hands on the knees. So if you ask them to lean forward with support of the hand, put the hands on knees, ask the patient to put hands on the hips and push inwards, flexes, and also we have to ask them to bend forward and backwards. So any changes of the like a breast tissues, or if any lumps or anything is it any changes, and also look for any other colors. So is there any color of the breast is changing during the movement? So that's why we have to ask them to do like a move forward and backwards. So in the sitting positions. So coming to the next one is the palpations. So we have to use the fingers or otherwise ask them to do the like a self like a palpations. So they have to use the or also the examiner has to use the only use the palpable only finger pads. So these finger pads we have to use, and also I have to move it in the all the directions. So we have to do it in the upper quadrant, that means outer quadrant, lower outer quadrant, upper inner quadrant, lower inner quadrant. That means all the areas. So upper inner quadrant and also lower inner quadrant. We have to divide this breast into four parts. So these areas, the four areas are, we have to like do it in the circular motions and to identify the any like a lump or any tenderness or any extra tissues. So we have to identify with the palpation. The palpation should not elicit the pain. So we should not put more pressure, and also should not gives the elicit the pain. And consistency is I variable. So it should be consistent. That means how much you pressure applying to the upper quadrant, and also how much you are applying for the pressure. Same pressure you have to be the lower quadrant. So should not be change the pressures. So in the palpations we have to check it. So if you find any abnormality, so we can note it down. So where exactly having the lump, where having the pain and tenderness. And also in the sitting position, in the first, and also examine sitting, and also examine the normal side first. So if the person complain the right side pain, so then first we have to check for the left side. Then we can easily differentiate the right side as the affected part and also non-affected part. So place a hand behind the head. So we can, if we ask them to hold here, first we have to check the one quadrant at one time. So that means ask them to do the first we have to do the upper inner quadrant and also upper like a outer quadrant. Then is a lower inner quadrant and lower outer quadrant. So we have to divide the breast. So we have to palpate in the all the directions, but should be in the one quadrant only one time. In the supine lying position. So after sitting positions, yeah, if you find anything, if you are not found anything, then ask them to go for the supine positions. In the lying positions, so in the lying position, the breast is going to be spread evenly. So that means maybe in the supine, in the standing positions, maybe it may like a they won't get the complete a comfortable positions, or maybe it won't comes to the equal size because of the maybe other like a shoulder like a spinal deviations, or maybe spinal abnormalities, or maybe it may alter the position. But in case of like in the supine lying positions, the breast is going to like a even positions, then we can easily assess clearly. So here we are going to the breast going to be evenly spread, and examine lying down, and also use one or two hands to elicit the lump. So we have to use is either one hand or maybe use the both hands to elicit, that means to find out the lump. If we'll define the lump with the fingertips. So if you after that, so we have to, if we find the any lump, So then we have to touch with our fingertips. We have to where exactly the lump. And also here, press the breast against the chest wall. So here we have to rolling fingers in a small circular motions. So ask them to do with the fingers in the small circular motions and press lightly for the superficial layers, and also medium pressure for the middle layer, and also firm pressure for the deeper layers. So it starts from the is a sternoclavicular junctions. Sternoclavicular junction. This is the sternum bone. This is the chest bone. This is the clavicle. So here, start from here. So we have to ask them to do like a self-examination, or maybe we have the examiner has to start from the sternoclavicular junction. So move and also overlapping the vertical strips until the all four quadrants are covered. So we have to cover the all the four quadrant, upper inner, upper outer, and also lower inner and also lower outer. We have to cover the all the four quadrants, and also with the same consistent pressure. So in one quadrant is a little more pressure, in another quadrant is a film pressure. We should not do. So it should be is a consistency should be there. And also after assessment, so we have to check for the cancerous, if any cancerous tumors or masses. So we have to find the location, size and shape and number and consistency. So these things we have to find it. And also we have to any exact definitions, so where exactly, and also either mobility is there or not, is movement in the lump is movable or not, and also tenderness is there or not, and pain while pressing. Erythema means the redness. Dimpling or retraction. Dimpling means is like a holding, like a making the shrinken, or maybe is contracting positions, or maybe retraction, or any lymphadenopathy, or in case of any lymphadenoma, like any diseases, an enlargement of the lymph nodes or lymph glands. So we have to identify for the in case of the breast mass characteristic. So if this one is, so we have to go by one assessment. So comparison of the breast lumps. So here, what is the difference between the uh, benign tumor or maybe cancerous tumor? So benign means like a lump; it's not a painful. So here we have to check for the this benign will be the multiple or single, either only one lump or maybe two lumps may chance to get, and also it's going to be rubbery texture. So it's going to be the movable rubbery, and also it is going to be mobile and slippery. Sometimes you are going to find somewhere, and sometimes you may find the upper quadrant, maybe in the lower quadrant it may be mobile. And also there is no is a regular borders, is going to be, sorry, it is a regular borders, but in the cancerous one is going to be the irregular border. And also the tenderness, no retractions, may increase or decrease in size rapidly. So within the time period, so the size may be increased or maybe size may be decreased in the benign tumors. Coming to the cancerous tumors going to be unilateral, and also is a film texture, the fixed and also firmly, and also there is no movement, irregular border, no usually painless, and usually retractions, and grows constantly. That means it grows slowly compared to the benign one. Benign going maybe be faster, or maybe is going to be slow and maybe change the sizes. So that is the difference between the benign tumor or benign like a lump and also cancerous lump. And also we have to palpate for and also any discharges. So here we have to palpate the nipple. So this palpate the nipple for the mainly purpose is we have to check how the tissues, is it very hard or is it soft, and also we have to palpate the also areola, and palpate the depression under the nipple. So here also we have to palpate and gently press. So in between the index finger and also thumb. So we have to found any discharge is leaking or not. So if the discharge is color, any blood or maybe milk or any serous, so we have to found. We already discussed. So what are the clues? So then we can find any other type of discharge. So and also we have to do the as a axilla also we have to examine. So for the purpose of the any lymph node enlargement. So we discussed right the lateral one, central, pectoral. So these axillary lymph nodes we have to find it in the supine line position, and also palpate the axilla. So these things are mainly for the is mainly for checking for the lymph node enlargement. So these lymph nodes normally palpate lymph nodes less than 1 centimeter diameter usually is a clinically insignificant. If you palpate is the less than 1 centimeter, is a clinically insignificant. If it is more than 1 centimeters or bigger size, so it indicates the maybe any lump or any tumors. So we have to find the where exactly is it the central one or maybe is a apical and also anterior and also posterior group, where exactly having the lump depends upon the positions. So we have to place our hand according to the lymph node positions. And also supraclavicular and also infraclavicular also we have to check. So supraclavicular means above the clavicle, and also infraclavicular also below the clavicle. So we have to found any abnormality, that means any enlargement of the lymph nodes. So we have to check and palpate. And also, okay, next coming to the male breast cancer. So male breast cancer is very very rare compared to the women. So only 1% breast cancer is there. So although it's very rare, men can get the breast cancer. Men breast cancer is the most often found in the women, but men also can get for the breast cancer too. About one out of every 100 breast cancers diagnosed in the United States in a man. So only 1% getting in the men. So, what are the causative factors in the male breast cancer? So, male breast cancer is a risk in the men increasing by elevated blood levels of estrogen. So, which is a hormone, is a high level hormone in the men. Normally, it is there slightly. It's there, but it's if you who have more than normal level, so they may chance to get the breast cancer. And also, if anybody exposed to the radiation, and also any history of the family history. So, these are the causative factors of the breast cancer. So, and also one more important factor is genetic defects, that is, mutations are including the BRCA2 mutations. So, these are associated with increased risk of the breast cancer in the men. And also, BRCA mutation seen in the play a small role in the male breast cancer than the in women. So, it's going to be is more role in the women than the men. So, and also how the radiation, especially the radiation exposure, may produce the breast cancer. So this who are exposed to the is ionizing radiation has been associated with the increased risk of developing male breast cancer. So if any like a medical industries or such as any cancerous agents or maybe high metal exposure may chance to get the this metastatic cancer. Men who have previously undergone radiation therapy to treat malignancies in the chest area, or for example, if they exposed to the any previous like a radiation therapies for the like a chest cancer, or maybe is the Hodgkin's lymphoma, or maybe risk of the may chance to get the breast cancer. And also who have like increase the estrogen levels, especially those condition is called as gynecomastia. So who have gynecomastia may chance to get the breast cancer. So gynecomastia are commonly seen in the men. So the development of the breast may develop to one side or both sides. So this also associated with the male breast cancer. And also other than these causative factors, and also some side because of the some side effects also may chance to get the breast cancers. So these side effects because of the prolonged use of some medications also may chance to get the breast cancer. And some conditions related to the liver diseases and also some genetic diseases may chance to give the breast cancer, especially liver disease like a cirrhosis of liver. This liver may major role in the distributing the hormones and also is regulating the hormone functions. So if anybody having the cirrhosis means is the liver problem due to is alcohol, heavy alcohol. So may chance to get the damage of the liver function. So because of the liver functions, so it may alter the hormonal balance. So they may chance to get the hormonal imbalance and may chance to get the uh, like a breast cancer in the men. And also obesity is also associated with elevated estrogen. So who are getting the more like a BMI is increasing, so may chance to get the estrogen level. And also some other drugs because of the side effects, especially the high blood pressure drugs, so which who are using for the medication like a control the blood pressure, so may chance to get the side effects. As well as and also who are using for the anti like a antacid, or who are using for the to control the gastric problem also may chance to get the gynecomastia. So those people may chance to breast cancer. And also who are using for the some prostate cancer some medications, the valium, also finasteride. So these medicines are going to be control the some prostate cancer. So because of side effects of these drugs also may chance to get the breast cancer. So these are the most common causative factors in the men's breast cancers. And also here also they may chance to get the same the symptoms like a women what symptoms they may chance to get, men also will get the same signs and symptoms, such as they are going to get the breast like a abnormal swelling and lump, and also pain and tenderness, and also maybe they may chance to get the discharge. So if anybody discharge with the blood or fluid, so may chance to get the like a blood cancer symptoms, sorry, breast cancer symptoms. So and also after checking the after before getting the these symptoms, so if we advise to men and women both how to assess the self examination, how to assess the breast with the self examinations. So with the self examination, at least we can detect the problem early, and also treatment will be also as soon as possible. If they take the treatment, so we can prevent the complications as well as we can prevent the mortality. So that is the main aim of the self breast examination. So we have to advise to the men and women, and also at least every 1 month they have to check the breast examination. So most of the people they think that the breast only having only cancer will be only for the females, but because of nowadays many people are finding with male breast cancer. So that's the reasons we have to advise for the men and women. Together we have to educate, and also we have to give some educational classes to the everyone, so maybe it will be help to society and we can prevent the breast cancer as soon as possible. And also the main goal of the self examination is early detection and in preparation for the teaching also. So in the preparation we have to give about the some knowledge, and also we have to motivate to everyone. And also some people may having the some stress and also some fear and some worries about the small problems also. So that's why if they check every day, every month, before the menses, after the menses, so may chance to identify the problem easily, and also we can plan the treatment according to the conditions. So and also who already having the risk factors such as who already smoking, alcoholism and drugs, so who have these complication, and also history of family history. So we can give some education, and also they follow according to the guidelines, so we can find the breast cancer in the early and prevent the complications. And also we have to teach, and also how to use, and also how to use the finger pads to assess the a breast lump or and also any lump or maybe any abnormal breast tissue. So these things when we have to advise, so especially so in the females, if they are in the menstrual period, so at the time of the fifth and seventh day, in between the fifth to seventh days, if they check the breast and also they can find any abnormality, so that is the best time to check the breast every month. So and also in the menopause, in the if anybody reach to the menopause, so they have to continue the same days in between the fifth day and also every month in the fifth and also seventh day, so they can find, also they can easily found the defects. And also in conjunction with the mammography and also CBE, other than the self examinations, so we can advise with at least a yearly once, so the every woman should go to the mammography and also CBE. Mammography means the special X-ray for the breast, so they can identify if any defects and also easily found, and also we can prevent the breast cancer. The complete blood examination also, so if any infection or if any cancerous cells, so we can give the special profiles, in case of breast cancer profile, or maybe is WBC and red RBC, ESR levels. So these things are also going to help to detect the breast lump and also cancerous tissue. And also how to find how to go diagnose the breast tumor or maybe cancer. So the simple thing is the doctors are going to find the if anybody get the doubt if they are lump or any painful, so according to the symptoms, if they consult the doctors, they are going to do the as soon as possible the diagnosis process. So these diagnoses are maybe they are going to do the needle aspiration or maybe biopsy. Needle aspiration is nothing simple, simple like a procedures. They are going to insert the needle into the breast tissue, and also they are going to take they are going to aspirate the tissues, and they are going to send to the culture, and also by the pathologists are going to find the any abnormal cells in the breast tissue, so they are going to confirm it is there any normal tissue or abnormal tissue. And also another one is another going to be is the a biopsy. So this they are going to take out the small piece of the breast. They are going to incise, and also they are going to excisional removal of the some breast tissue. So they are going to send to the histopathology lab. There they are going to find the abnormal tissues in the, if they found any abnormal, so they are going to check, and also they are going to confirm it the breast cancer or normal. And also one more thing, a microscopic examination of the smear test. So the smear test is nothing but from the discharge fluid. If any fluid comes from the nipple, so that discharge also sometimes it may they are going to diagnose and from the discharge fluid. So these are the diagnostic some procedures. Other than these diagnostic procedures, and also we can advise, and also through the some the investigative procedures such as X-ray, CT scan, and MRI scan, and ultrasound scans. So these are also is helpful to diagnose the like a breast cancer and also any other like a lumps. And also according to the American Giant Committee on Cancer. So they also using the some like a TNM staging system. So they are also considering about the TNM staging system, that is according to the T for the tumor size, N for the lymph node involvement, and also M for the presence of metastasis. So if any these things found in the like if anybody were confirmed with these symptoms, so they are going to confirm it with breast cancer, and according to the stage, so doctors are going to give the treatment plan according to the stage and symptoms. So what are the stages? So here we have to discuss about the stages, how we are going to confirm the this breast cancer. The stages are going to be like a 0 to 4 stages are there. So again, these some stages are going to be divided into two stages. If you see the zero, the stage zero, here is going to be involved only intraductal. So it's not going to involve in the like a it's not going to lymph node involvement is not there. Only it's going to be intraductal, and also it's not reach to the beyond the this cells. So only is going to the ductal region only is going to be involved. And also in the stage one, so the breast cancer tumor is going to be is that less than 2 centimeter or less in the greater diameter, and has not spread to the lymph nodes. The first one zero and first one is not going to involve to the lymph nodes. So it's going to be less than I said 2 centimeters or less the less extension to the tissues. Coming to the stage 2, this stage 2 divided into the again two stages, stage 2A and stage 2B. So this stage 2A is going to be is a less than 2 centimeter diameter with a spread of axillary lymph node. The tumor has is been between the 2 to 5 centimeters but not spread to the axillary lymph nodes. So it's going to be 2 centimeters or maybe 2 to 5 centimeters. It won't spread to the lymph nodes. But if you come to the stage 2, that is stage 2B, is going to be the lymph node size is going to be between the 2 to 5 centimeters and also spread to the axillary lymph nodes. So it affect to the lymph nodes, and also the size also is going to be increased. So that is the stage 2B. So coming to the stage 3 is considerable is the locally advanced cancer. So this one stage 3A means tumor is smaller than the 5 centimeters but spread to the axillary lymph nodes. So this also going to be the so but is going to be is advanced stage. It's also locally advanced but is going to affect to the lymph nodes. If you see the stage 2, 3B also, tumor spread surrounding tissues like a skin, chest wall, lymph nodes, and also inside the chest wall. So these are going to be increasing the size as well as it spreads to the surrounding tissues. So it is called as the stage 3 and B. Coming to the stage 4 is going to be is a cancer, is a, like a metastatic cancer. So that means it spread to the other parts of the body. With the breast cancer, so is going to be metastasis, is affects to the lung and also bone and liver, and also is going to spread to the brain. It may also reoccur in the spread of involvement and involve areas of chest wall, skin, muscles, as well as the distant lymph nodes. So that means it's a metastatic. It spreads from the one place to another place. If they get spread in the breast, so from the breast it may spread to the brain, it may spread to the liver, it may spread to the joints. So it may takes like it may spread overall the body. So it may chance to get this is the very serious conditions, and also it affects the lymph nodes. These in these conditions, those people are going to getting recovery so difficult. So that is the main chance to get the mortality. So how to prevent these things? So these things is, so we have to advise how to do the self examination, and also the self examinations. The self exam in the first step. So they have to in the every just according to our last discussions. So every month in between the fifth day to seventh day, so they have to examine themselves. So they have to stand and also in front of the mirror. So look for the any asymmetry of the breast, and also the breast shape and size and color, and also breasts that are evenly shaped without visible distortion or swelling, and also if there any swelling or any color change, so they have to find out. And also in case of if any changes, they have to consult the doctor immediately. For example, if they're having a dimple, or is there maybe wrinkle formation that is occurring, or bulging of the skin, so in those conditions immediately they have to consult the doctor. And also they have to observe the nipple. If the nipple is retracted or inverted, or maybe is going to be like a sucking sticking out, and also they have to check for any redness, sore, rash, swelling. So in front of the mirror, if they stand, so at least they have to observe, inspect their breast at least minimum 10 to 15 minutes. They have to observe clearly and also identify the any problems, any abnormalities. So in the next one, in the next stage, so they have to stand in front of the mirror. So then if they raise the arms, so they can change again the check for the any asymmetry, any size, and also they have to hold the nipple in between the index finger and thumb, and also if they press it, are they getting any discharge? Is it a fluid or any milky or any blood? Or they have to find out. So if any discharge, immediately they have to consult the doctor. And also in the supine lying positions, so they have to check the breast. So in this position the breast will be like a freely movable, and also is going to be spread like a throughout the chest. So in that time, with the right hand they have to feel the left side of the breast, with the left hand they have to feel the right side of the breast, evenly apply the pressure with the consistency, and also found out the any like a hardening nodule or any tissues, hard tissues. And also in this one they have to apply from the in the vertical position from the collarbone to the until the upper abdomen, and also from the midline to the into the axillary line. So they have to feel it, and also with the prim pressure, and also in the circular motions. So this in the they practice in this in this methods, so they can easily find. So every month checking is the important thing, so they can easily find out the problem. And also it should be in the relaxed position. The person should be in the relaxed position, in the lying positions. Application of pressure should be in the all the three directions. So in the vertical directions, and also clockwise and also anti-clockwise, and also how to apply the all the four quadrant, upper and also inner upper quadrant, and also upper outer quadrant, and lower upper quadrant, lower is the inner quadrant and outer quadrant. So in the, all the directions, if they apply and pressure equally, so can find easily. So and also one more important thing is in the free in the everyday in the shower time. So if they apply and also raising the hand, and also application of the like if they apply the thumb pads over the breast in the circular motions with the water is going to prevent the friction. So every time if they check in the clockwise and anti-clockwise, vertical and horizontal directions, if they apply the prim pressures, so they can easily find the any lump or any hard tissues. So these steps, if they follow, they can continuously, like every month, and also in the free time during the shower time, so they can easily find the any abnormal tissues. And also this is the self like a assessment. So if you understand about the self examinations, so and also awareness of the breast cancer, so they can at least if they follow some guidelines and also some preventive measures, we can prevent, and also we can reduce we can reduce the some percentage of the breast cancer. So these are the very simple who already having the some like a risk factors such as the alcohol intake and smoking and drug intake, and also if they are not like a sedentary lifestyle, if they're having hormonal imbalance, so they have to consult, they have to take the some precautionary measures, and also from the doctors, if they follow, so we can prevent the breast cancer. So these are the prevention measures are only thing is the limit the alcohol, so they have to control the alcohol intake, and also smoking, stop the smoking, and control the weight is also very important. If they reduce the weight, and also we can prevent the cancerous causative factors. And also at least they have to spend like some regular work exercises minimum per hour for weekly, at least to 150 minutes. We can control the breast cancer. The working hours, like at least the regular physical exercise every day if not possible, so at least weekly, like a one and a half like a 1.5 hour to 2.5 hours, so it will be helpful to control the breast cancer. And also limit the dose and also duration of the hormone therapy. If they are taking any hormone therapy, so we have to ask them to control and limit the duration, and also avoid exposed to the radiations and also environmental pollutions. So this just now we discussed, if they are working in any metal industries or chemical industries, or if they having previous cancers, so if they exposed to the radiations, so may chance to get the cancer. So if we limit in the exposed to the radiations also, we can prevent the breast cancers. So that's all about the breast assessment and also breast examinations. So if you understand clearly, at least we can advise to your near and dears, so we can prevent the breast cancers in the future. Okay, that's all about today's topic. Hope you understand. If you have any doubts related to the breast cancer and also breast examination, you can give me one message. I can clarify to you. Okay, that's all about your topic. Thank you very much. See you in the next class.